Good evening, everyone. Welcome to this week's Wednesday Wellness Minutes. This is Dr. Schilling with Sequoia Health, and this week we're going to talk about a hot topic in the news. I've had one of our patients reach out to us and ask us to give more information about the polio-like virus that's going around that people are being affected by. So we're excited to share with you this evening some information that might help you feel more calm and should educate you as far as what you should expect as far as these things go. The symptoms that people are experiencing is called acute flaccid paralysis or acute flaccid myelitis. Okay, they don't really know what type of virus it is. Right? They haven't been able to pin it down. That's why they say it's a polio-like virus. So we want to kind of give you some information about understanding viruses in general and understanding how this one or whatever it might be is affecting your body. Generally speaking, the acute flaccid paralysis is a result of some type of swelling in the spinal cord. At least that's the theory. And it's most notably associated with, in the past, poliomyelitis. So break down myelitis for a second, muscle inflammation. But then we have acute flaccid paralysis. That means the muscles are not working. And therefore, if it's not in the nerve itself in the muscle, they're going back to the spine to understand why it's happening in a certain part of the body. Oftentimes people have weakness or inability to move their lower half. That might happen in an arm. It just depends on what part of your body is being affected. From a brain standpoint, you want to understand that all viruses, they're called intracellular obligate parasites. They can't live unless they're in your cells. Once a virus is in you, it never leaves you. It's always in there, either it's hiding or it's replicating. When you have symptoms, it's in replication, your immune system's fighting it off. When your immune system is strong, it will not be able to come out of hiding. Therefore, stay strong, viruses won't come out of hiding. This virus is not new. There have been multiple cases over the years of reporting on this. So let's just talk about acute flaccid myelitis, right? The AFM, or the acute flaccid paralysis. They have tried to lump it into the polio family because it shows up in muscles, but they really don't have any idea what it's about. We just want to kind of give you some information about that. The family of viruses is called an enterovirus. That's what the poliovirus family is. But there are hundreds, if not thousands, of different viruses that can affect your body. Most notably, the herpes family. It's even been implicated that bacteria can cause this type of symptom. Borrelia is a common one. People associate Borrelia with Lyme disease. There are a lot of different areas that can be affected by this. Some of the major recommendations that the medical establishment is giving you is stay up on your vaccinations. Make sure you're getting your shots. But keep in mind, it's not a polio virus. It's a different type of virus. So unless you have a virus for the Epstein-Barr virus, the cytomegalovirus, which are their cousins, the enteroviruses, all those different viruses, if you get a vaccine for something in a general standpoint, you're not going to get the coverage or the protection you need, right? So don't be scared into thinking you need to get yourself shot up with every vaccine in the world just to stay safe from this particular one. It's actually not a very common virus. I believe 6 to 8 different children have developed the acute the acute flaccid paralysis in Minnesota, 14 in Colorado, and then I think across 16 different states in the country, about 38 different children have been affected by this. It affects your mobility and things like that. But the CDC, and I heard a quote this weekend from a fellow presenter. I was down in Nashville doing a presentation online for Desert Biological, DesBio, who we sell a lot of their products because we help our patients with them. And he called the CDC the Center for Dumbness and Confusion. And of course, the whole crowd was chuckling for anyone in the natural healthcare, but it is an organization that is supposed to raise the elevation of knowledge in the general public about what you need to do to protect yourself and stuff like that. But it is often maligned and very often criticized for its inability to provide useful information. At any rate, it says they're making slight progress in narrowing down the cause of this acute flaccid paralysis, which is very helpful to any parent who might be freaking out at this point. And therefore, you want to understand that you can have a droopy face, which can also be Bell's palsy. You can have slurred speech. You might have some digestive challenges if it's affecting your stomach and things like that. But again, the risk of transmission is low. And with any virus, no matter where you are, a good recommendation is to have clean hands. But remember, viruses are all over the place. It's very unlikely you're getting exposed to anything new in your environment unless you've traveled out of the country where there's going to be different bodily viruses, parasites, bacteria, and molds and funguses that we're not accustomed to experiencing. So just assume you have not been exposed to something new. This is getting exposed in certain children, probably due to the fact that the sun has gone away. We haven't had any vitamin D from the sun since September 9th. and our immune systems are getting weaker because we're not getting almost any sunlight. We're not getting as much activity given the winter months are coming and it's fall and everything like that. So just keep in mind there's a culmination of different factors that are coming into play here. They have actually ruled out the poliovirus as being the culprit for this, so that's important to understand. So don't worry about neurological exposure or implications of a poliovirus, because it's not a poliovirus. The best I can tell by examining the different cases that have cropped up throughout Minnesota and things like that, my best guess, and I don't know for certain because I haven't examined these children and I haven't had a chance to evaluate them, I suspect the cytomegalovirus is playing the biggest role currently. And we don't need to get into why these children might be under different stressors and have different conflicts in their life that are allowing this virus to come out and be exposed and be problematic for them. What you want to appreciate is it's less than 1 in a million children. Now, I know that's not much comfort for a parent, especially being a parent, that your child might be affected by this, but understand that viruses are grouped together and your body has different tools to manage different types of viruses. So whether it's CMV, cytomegalovirus, EBV, Epstein-Barr virus, whether it's an enterovirus, maybe it's a Campylobacter bacteria, whether it's a Borrelia bacteria, if you give your immune system the strength to support in that area, it can overcome just about anything. So therefore, if someone is suffering from an acute flaccid paralysis, A, you want to figure out, is it in the spine? Is it in the spinal cord? Is it affecting their nerves and things like that? B, is it a virus? Is it a bacteria? You got to narrow it down and then support the immune system accordingly. And until they have a blood, urine, or saliva test in the medical world to do that, to determine what virus it is, they're going to be pretty limited as far as that goes. We specialize in the weird, as you've heard me say before. People drag in the weirdest stuff possible, and whether it's a skin issue that's coming from a parasite in your gut, or it's headaches and migraines due to a virus in your liver, or chronic low back pain because of bacteria in your kidneys. It just depends on what it is. So our job here is to find that information and set your mind at ease, knowing this is what it is. This is the conflict in your life you need to address. Here's what you need to take in order to support your body and get stronger. And this is what you can do to support yourself in your healing process. So that's our role here. Oftentimes these things come in a cluster in time. They're called temporal, not the temporal bone or temporal side of your head, but temporal meaning time frame. And not all children get it nationally. I mean, it's kind of a silly thing to say. Not all children nationally have suffered from this virus. Clearly, if we're talking 6 people in Minnesota, I think there's 2.6 million people in Minnesota, 6 people. Obviously, children are being predominantly affected by it, but you just want to appreciate that if you turn on the news, understand that they're going to hype everything that happens. They're going to scare you because their job is to sensationalize everything that's happening, because then you have a 24-hour news cycle to get people to watch it. Then they can sell their ads and things like that. You just have to appreciate it. If you're going to turn on the news, you know that there's some bias involved. No, I don't care if it's NPR, CNN, Fox, it doesn't matter who you are. They're all biased. They're all trying to convince you to do something. So if you think they have your best interest in mind, you might want to reconsider that idea. But they urge people to stay calm because it's affecting less than 1 in 1 million children. Okay? Some of the things that they do to try and get the nerves back going are electrical stimulation. So they're actually going to shock the muscles and try and do that. They might even undergo nerve transplants. Sign me up. That sounds like a fantastic idea. All you have to do is find the offending organism in the body and go about healing the body and elevating the immune system, because as far as the immune system goes, a competent immune system can handle just about anything on the planet, provided it's given the right resources and that the mind is clear and the conflicts are resolved. So we just want to appreciate that, there have been no confirmed deaths of anyone, not in Colorado, not in Minnesota, not anywhere else in the country. And so you want to appreciate that this is a scary idea, but you don't know if it's bacterial, you don't know if it's viral. Unlikely to be fungus. It could be a parasite affecting the brain, affecting the motor cortex, somewhere affecting the muscle tissues and things like that. But stuck and restricted and things like that are issues related to muscles. You'd want to dive down into not just the immune system, but into the neuroemotional side of things to get a better understanding of these things. So I would caution anyone from being overly concerned about this. Obviously, you're not going to, I strongly encourage you to avoid walking around and diving in a ditch if you see somebody coughing and hacking and sneezing and carrying on. I know the germ theory has been popularized for decades. Louis Pasteur, which I think developed the germ theory, actually on his deathbed recanted and said that the other guy who had the other prevailing idea at that time when these guys were both duking it out, and that it was really the terrain, the body terrain, that was the problem, was the bigger issue. So it's not the bugs, it's the terrain. What are your toxin? What's your toxin load? What's your stress load? Okay, what are you putting in your body, right? And what is coming out of your body? If nothing's coming out, you're gonna have problems. If you're putting junk in, you're gonna have problems. If you have junk in your brain, if you have stressful relationships, if there's abuse, if there's stress, it's going to cause your immune system to crash. These are some things you want to consider. If you have a question about your particular case, if you think, oh my gosh, my kid's suffering from this virus and I don't want to turn it into acute flaccid paralysis, give us a call, let us know what you're dealing with, let us understand what you're dealing with. We'll provide you every information we can. If it's necessary, you seek out medical attention, absolutely, we're going to give you that recommendation, because my job is not to keep you alive or save your life. My job is to make you feel well and enjoy life. That's our job here at Sequoia Health. Enhancing the quality of life is part of our mission, and therefore, if you need your life saved, you go see a medical doctor. They're the fantastic one. We just talked about this last week in terms of our mission. You go see who does the job you need done. If all they can say is wash your hands and get vaccinated and things like that, that's not really going to protect you over time. You need tools. You need something that's going to support your immune system and actually educate it. That's why we use complex homeopathy, because it educates your immune system and gives it the tools to handle things over time. It's not just, oh, I'll give you a shot in an arm and hopefully this vaccine is going to do something for you. We want to make sure we're educating your immune system and giving the tools, and then teaching you how to live a lifestyle that's getting rid of stress and helping your immune system and getting toxins out and balancing your organ systems and energy flow so you can live the highest quality of life possible. Please let us know, give us a thumbs up, or share this with your friends and family who might be talking about the acute flaccid paralysis that they're freaking out about. I know a young lady called us or sent us a message via Facebook and asked us to talk about this. Wonderful human being, has a lovely young daughter, and I know she's concerned about it just because all of her friends are talking about it, over their coffee or yoga or whatever it might be. Everybody's freaking out, like, oh my gosh, my kid's going to get AFM or acute flaccid paralysis, what's going to go on? But remember, no one has been shown to die from it, right? Only 6 out of the 2.6 million people in Minnesota have actually been affected by it. So stay strong, stay healthy, clear mind, exercise, get good vitamin D, simple things you can do, eat your greens, eat your rainbow, right? Minimal fruits, lots of veggies, good healthy proteins and fats and veggies. Eat organic, it does matter, it does matter. If you think you can't afford it, then skip a meal. Because I can assure you our ancestors had plenty of times where they didn't go eating. So if you can't afford 3 squares a day, but you can afford 2 organic meals a day, stick with the 2, forget the 1, you'll be healthier. I mean, our team member Amelia right now, she's on a 10-day fast, as you may have already seen she posted about, or maybe she's sharing on Instagram. I know we get ramped up like, oh, I'm hungry, I'm starving, right? If any human being in the first world says I'm starving, you got a problem, because just go step over into the second or third world countries where kids go days without food. All right, it's scary. There are kids in the U.S. that actually go days without food, right? The only food they get is when they go to school, all right? And then the well, we won't go into that. All the dairy and all the garbage and whatever. Anyway, please share this. Help support our mission. Help us help other people. We're empowering people. We're raising the quality of life. We're raising the standard, right? Our mission is to change the paradigm and create actually a healthcare system and not a sick care, not a disease care system. Don't treat the symptom, treat the cause. And that's what we do here. So let us know we're helping you out. Let us know we're calming your nerves and allaying your fears. That's our job. So if you need information, give us a call, give us an email, send us a text, fire it up on Facebook or Instagram, whatever you need. We're here for you. Have a great night. We'll see you next Wednesday.